Breaking news and huge changes coming to short-term medical plans September 1st, 2024. So stay tuned so you can learn more and maybe enroll before it's too late. Now remember, we are licensed health insurance brokers, so if you have questions, you can reach us in the comments below and also at the number on the screen. And of course, there is no charge for our services. And these changes are coming about on September 1st, 2024, so don't dilly-dally if you think a short-term medical plan might be for you. And of course, please make sure to like and subscribe to stay up to date. So let's jump right into it. There are some huge changes coming to short-term medical plans on September 1st, 2024. So in recent years, you could actually enroll in a short-term medical plan for a period of up to 3 years. But as of September 1st, 2024, new enrollees will only be able to enroll for a period of up to 90 days with a potential 1-month extension. So that's a pretty significant difference. And why the reason for this change? Well, we can report on what we've heard so far, but of course, please feel free to sound off in the comments below. Basically, with plans that don't require medical underwriting and have no change in prices for pre-existing conditions, then those plans are balanced by a healthier population versus a slightly unhealthier population. Basically, the premiums remain in balance because, yes, there are people that have higher medical needs who utilize their insurance more frequently, but there are also people with lower medical needs who don't utilize the services as frequently. So this keeps everything in balance. And as I said, for marketplace plans, there is no medical underwriting and you can't be denied or charged more based on a pre-existing condition. More on this later in the video. Now, short-term medical plans can offer lower monthly premiums, especially for those that are healthier with lower medical needs. And this can throw the whole system out of whack because generally speaking, somebody with a pre-existing condition or higher medical needs isn't going to opt for a short-term medical plan because they might be denied, their pre-existing condition might not be covered, or they might be charged much more, making it just too expensive. So short-term medical plans tend to appeal to people that are healthier with more limited medical needs. And this can really throw the whole system out of whack because then you have short-term private medical plans skewing towards the healthier population, for a lack of better words, and then you have the marketplace plans, which because of no medical underwriting and the inability to deny or charge more based on a pre-existing condition, may have the quote-unquote unhealthier population. But it's not just that this may throw the system out of balance. Short-term medical plans are not required to offer the 10 essential benefits. As a result, the health coverage offered may not be as comprehensive. And sometimes people find that the benefits they thought were offered aren't really offered by their plan, leaving them with little to no coverage in the areas that they need. For example, a man with cancer found out that his cancer was not covered because it was considered a pre-existing condition, and there was a woman who wound up with $20,000 in medical bills after an amputation because her insurance carrier didn't cover it. Now, a short disclaimer here. There are many short-term medical plans that are great that offer pretty darn comprehensive coverage. There are many marketplace plans that, while offering the 10 essential benefits, offer very restrictive networks. There are people who are in the pinnacle of health who opt for marketplace plans, and there are people with pre-existing conditions who opt for short-term medical plans. It's all different, it's all individualized. We're just talking about sort of the average terms here. So overall, this certainly could have a positive experience on those who already enroll in a marketplace plan. But for those who opt for a short-term medical plan for various reasons, obviously this is less than desirable news. There are many people who opt for a short-term medical plan because they make too much money to qualify for a premium tax credit through the marketplace, but really too little money to pay for those full-price plans. So let us know in the comments below. Should we be rolling back short-term medical plans? Is there another better solution? What are your thoughts? Now, that being said, there is still time to enroll in one of those 3-year term plans if a short-term medical plan is right for you. So let's talk about some of the pros and the cons. So this chart will highlight the differences between short-term medical plans and marketplace plans. So short-term medical plans will offer you PPO coverage, which means you do not need a PCP, you don't need a referral to see a specialist, and you can go in and out of network. And pretty much if you are somebody that's going to be traveling the United States, perhaps you're a digital nomad, then a PPO is certainly the ideal way to go. Now, for marketplace plans, PPOs are very hard to find. You'll mostly find EPOs and HMOs. An HMO requires a PCP, which is a primary care physician. You will need referrals to see its specialist. And of course, you will only have coverage in network, except in the case of a true medical emergency. EPOs are somewhere in between. You don't need a referral to see a specialist, but they're still only in-network coverage, except in the case of a medical emergency. Short-term medical plans, as we've discussed, require medical underwriting, which means that if you have any pre-existing condition, if your health is not optimal, then you could be charged more, you could be denied outright. That being said, if you do have a more basic pre-existing condition and you enroll in one of those 3-year plans, yes, it won't be covered in the first year, but it likely would be covered in the remaining years of your plan. For a marketplace plan, there's absolutely no medical underwriting, so you cannot be charged more, and you cannot be denied. Now, short-term medical plans do not offer the 10 essential benefits, and that's really sort of their downfall. For example, they do not cover pregnancy under any circumstances. So if you are someone who's looking to start a family, then a short-term medical plan is definitely not for you. That being said, short-term medical plans really are entirely customizable, so you can more or less pick or choose the benefits that you need to suit your needs. And there are plans that certainly offer more comprehensive coverage than others. Now, all marketplace plans must offer at least the 10 essential benefits, and many offer more to compete for your business. For short-term medical plans, if you are someone who is perhaps younger or healthier, then it's likely that you would qualify for a pretty low monthly premium, maybe even under $100 per month. Now, unfortunately, there are no financial incentives here, so short-term medical plans don't take into consideration your income. On the other hand, marketplace plans do, of course, take into consideration your income. And if you are eligible for a premium tax credit, you could get a plan for less than $10 a month, possibly no dollars per month. You do need to make sure to estimate your income as accurately as possible, though, because if you end up making more than you estimate, you might have to pay back those premium tax credits when you file your taxes. So, short-term medical plan, marketplace plan, what do you think is best? Let us know in the comments below. Of course, if you have any questions about your health insurance, you can reach us not only in the comments, but also at the number on the screen. We are licensed nationwide, and there is absolutely no charge for our services. As always, thank you so much for watching, and have a wonderful day. Bye-bye. Before you go, make sure to like and subscribe to stay up to date. Also, if you want to learn more about all your health insurance options, make sure to check out this video, which is the ultimate guide to health insurance. We'll see you next time.